Thank you. After that last introduction, you're probably expecting Princess Leia. So what I'd like to share with you today is a journey that I've really taken over the last 6 years. Service in medicine has always been very important to me. I've spent my career working with underserved, working for our veterans and other people who really can't afford health care in the United States. 6 years ago, I was finally at a point in time in my life where I could take the time away from my professional career to start working in international humanitarian aid surgery. I started, as our host said, with Doctors Without Borders, Médecins Sans Frontières. I've done exclusively all my work in sub-Saharan Africa with them in French-speaking countries. I've worked with some other NGOs, and more recently, I'm actually working with Stanford University doing medical education, actually in Zimbabwe. So what I'd like to do is I have an audience participation question. Not that I can see you with these very bright lights, but hold your hand up if you believe that surgery is part of the global health agenda. Let me just see a show of hands. Okay, I would say that's a pretty good majority. And you would be pretty smart about that. This is the world. And in the world, if we could bring the lights back down, that'd be good. 11% of the diseases that are treatable in the world are actually treatable with surgery. What this translates to is 234 million major surgeries worldwide. These are not small surgeries like a little skin excision. These are actually major surgeries. But what is amazing is that only 3.5% of those are actually done in low-income countries. And when you think of some of the things that might cause you to have a surgery, accidents, road accidents, and falls would be common things that might cause that. And when you look at injury deaths across the world, 90% of injury deaths are actually occurring in these low-income countries. And when you put all of this data together, it is a staggering 2 billion people on the face of the planet who have no access to surgical care. So is surgery scarce or common? I've personally had 5 major operations, so I guess for me it's pretty common. But that depends on, obviously, where you live. 1 in every 25 people has surgery in the world, but 30% of the population is consuming 75% of those operations. And all of us know about HIV, we hear about it a lot in TB, we don't really hear that much about surgery. And amazingly, the amount of operations performed in the world is 7 times greater than those people with HIV. Now, when the UN got together with a bunch of low-income countries to come up with what was called the Millennium Development Goals, these were goals that were to help countries achieve greater health and less poverty. Surgery was nowhere included in these goals, even though 2 of the 8 goals had to do with maternal health and child health. And unfortunately, many problems, such as even simple things like a club foot, appendicitis, people have no access to care for these simple problems. So I want to introduce you to surgery. Burns, hernias, cancers, infections, congenital birth defects, gastrointestinal diseases, trauma, and maternal and fetal health. And I would challenge you that everybody sitting in this audience has either been personally touched by one of these 8 disease categories or has had a loved one who has been touched by them. These are not unusual things. So is surgery part of the global health agenda? And that answer is no. And I think today, why not? Why is it not part of it? Is this recognized? So Paul Farmer, one of the most important medical humanitarians, has called surgery the neglected stepchild of public health. He actually said this years ago. Has anything really changed on this forefront? No. So why not? Let's look at some of the issues. Why is this continuing this way? And it's a very commonly held dogma that surgery is very expensive and it's not cost effective. And anybody who's ever gotten a bill for a hospital and a hospitalization in America would think it's very expensive. Obviously, this requires trained personnel. You can't just do surgery. And the perception of many global health leaders and politicians is that surgery is not part of basic care. You don't need a surgeon. We are a luxury item. So let's look at the truth. Surgery is cost effective. So if you're going to do public health, you have to learn what a DALY is. This took me years to understand, because this is how they actually assess disease burden. And one DALY can be thought of as one lost year of healthy life. So let's look at the data. Oral rehydration for diarrhea, something every parent in here has done at some point in time for their child, $35 per DALY. It's a good investment. A measles vaccine, $5. Surgery, $11 to $33. This is not expensive. Compare that to HIV treatment or even condom distribution and promotion. Those are in the hundreds of dollars. So this data is not new, it's been around, so surgery, I would submit, is very cost effective. How about the trained personnel? This is a huge issue. So this is a graph where on the bottom are 9 African countries, and then obviously the large blue bar there is the United States. This is a per capita graph of how many surgeons per 100,000 people in your population. Not a single African country except one on this graph has more than 1 surgeon per 100,000 people, as opposed to the United States, which has about 45. To put this into a geographic context, this slide is fascinating. This is the continental United States drawn on the map of Africa. So think about the disparity here, just in landmass size. 45 surgeons per 100,000 population in the US and all of Africa. So is surgery a basic need? Nobody's really thinking that. So what I'm going to do is take you on a little journey of 3 patients that I've taken care of in Congo over the last few years. Let's talk about hernias. There's a lot of men in this audience. 1 in 4 men are going to have a hernia. It's about 5 million per year in the United States, 750,000 cases done. Worldwide, 20 million. Let's meet Francois. Francois is a 25-year-old male. He's a father of 4. He works as a farmer. He sends his children to school, which in most African countries means they're paying school fees. And he's the sole provider for his family. He shows up, in French we call the emergency room the salle d'urgence. He shows up there, and he has a very large and tender scrotum. This is what a strangulated hernia looks like. This means that his intestine is stuck down in his scrotum and has twisted off and is dying. If he does not have an emergent operation, he will actually die from this because he'll have perforated intestine, and that's not something you're going to recover from. Fortunately, MSF had a hospital there, and I was there. We were able to take him to the operating room. This is actually the photo from within the operating room. And you don't need to be a doctor to see that there's nice, pink, healthy intestine next door to nasty, dark-looking intestine. And so what we were able to do here is take out the dead intestine, sew the good intestine back together, fix the hernia, and here's Francois recovering. I was fascinated. I was online. I occasionally cruise the UN website, don't ask me why. And there was a new resolution that just passed last month about road traffic safety. Even the UN realizes the global public health and development burden resulting from road traffic crashes. Now, does that mean there's anybody to take care of victims of road traffic crashes? No. So this is a picture from literally about half a block down from where I lived in Congo, and this is typical Congolese transportation. You have a horrific road, you have all sorts of variants, interesting styles that people will use vehicles on the road, and believe it or not, people will pay to be on that truck. So they take a truck, they put as much stuff as humanly possible on it, and then about 40 people will pay to ride on top of that truck. And that is how the average population transits from here to there. So let's meet Marie. Marie was on top of a Congolese beer truck, Primus Beer, comes in 1-liter dark bottles. And there was about 40 people on top of this truck when it had an accident. Actually, we were the only hospital that had staff. They brought us a lot of these people. This is Marie and her daughter. Fortunately, her daughter just had some minor abrasions, But Marie has a significant fracture of her knee. This is not a fracture that can be taken care of with just a cast. This is a displaced fracture, and without some type of surgical correction, she would really not be able to have a functional leg in the future and would not be able to fully work or walk normally. You can see Marie here after we operated on her. That thing on her leg that looks like Tinker Toys, that's actually called an external fixator device, and that allows this fracture to heal in. And 2 years later, I have no idea how she knew I was back in the hospital, but she did, and she brought her sister to visit me. And I was pleased, I'm not an orthopedic surgeon, and I was pleased to see that she had a functional knee and was working, and needless to say, I was very happy about that. So how about the last patient? This is Patrice. Patrice is a young lady, 21. This is her second child. This baby is in the breech position, meaning that its butt is down towards the birth canal and the head is facing up. Now, sometimes the midwives can flip the baby so it can come out the normal way. In her case, though, that really was not possible. And when you can't flip the baby, it's a very difficult birth and can lead to a lot of complications unless you have access. If you can't get the baby out, you must have access to an emergency C-section. And fortunately, here is Patrice's baby being born butt first. I think that's a great way to come in the world. And here is my two Congolese nurses holding a happy, healthy baby, and Patrice was obviously able to go home with her baby. So just 3 small instances of what global surgery is. So what, right? How about this? I think as a nation and as a world, we have to reject the current dogma that surgery is not part of global health. And it is a pervasive dogma. When you talk to people, they do not even realize, they talk about maternal health. Somehow these people do not understand that cesareans is a surgical procedure. If you could do it some other way, I'm happy to learn it. But as far as I know, that is a surgery. We really need to help fund training in low-income countries. When you look at that disparity of how many surgeons we have versus sub-Saharan Africa, and you could draw graphs for other portions of the world, flying me to Africa to do your operation is not a solution to this problem. So we need to train people. And actually, Stanford is working in concert with the University of Zimbabwe on a grant from the NIH now, and I'm actually going back to Zimbabwe in a few months for my second trip. But we need more of this. And the last thing I would like to leave you with is that you cannot contemplate basic health care without including surgery in that equation. So I hope some of you know people in public health that could change this, and thank you very much.